Top of the morning, Dan and Amy, and it's not just frontline healthcare workers that are in need of PPE, personal protective equipment. Also, some of our frontline workers that serve particularly vulnerable communities, the developmentally disabled community, are in need of supplies as well as support during this time. And I want to talk to an executive at one of the bigger ones in the Chicagoland area. This, by the way, in the interest of full disclosure, I'm on the board of Envision Unlimited, uncompensated, but I am a member of the board of this organization, so just factor that in however you want. Mark McHugh is the head of it. He runs it day to day. He's the president of Envision Unlimited, and he joins us now. Mark, thanks for joining us. Appreciate it.
Thank you, Dan. Good morning.
Well, this isn't the way we wanted to focus people's attention on Developmental Disabilities Month, is it?
No, this certainly wasn't part of the plan.
Yeah, and so just give us a sense of, give us the scope of what Envision does and the sense of what the needs of organizations like Envision are during this outbreak.
Sure. Well, I'll kind of start with the basics. We've been around for 55 years, and our whole mission is about helping people have more choice in their lives, live as independently as possible, and be included in a larger community. So choice, independence, and inclusion is our mission. And our services are kind of built all around that. So for those people who need a place to live, we have homes with staff who are there, around the clock whenever individuals are in the home, day programs for day activities. We really promote employment. And in addition to that, we provide respite for folks who currently are unable to get more intensive services because they're on the waiting list, as well as help kids who are in foster care who have developmental disabilities.
And it's important, just to interject, it's important to note, the PUNS list, the prioritization for urgent need of services, is north of 20,000 people in Illinois. So when you talk about people waiting for service, you're talking about a huge number of individuals and families.
No, that's absolutely right. It's heartbreaking, some of the stories where people are just begging for some help and can't get it yet. We expanded our respite program to help some of those folks, and we're now in 18 additional counties in central Illinois as well as up in the Chicago area. So that kind of increased our capacity to help an additional 300 or so people. But the real solution is to both strengthen the program statewide so that more people get service.
And how has COVID-19 affected Envision Unlimited?
Yeah, boy, it's all COVID all the time. The biggest risk here is that is in the more than 300 people that we serve in our residential program. And it's critical because more than half of those people have a complicating health factor like heart disease or diabetes or something like that, or they're over 60 years old. So what we've done is we've closed all of our day services right now, and our employment training, and focusing everybody, like everyone else, staying home, and limiting the number of contacts that people have. So it's, we think this is the right track to keep people healthy. It has other implications because, like everybody else, folks are cooped up in the home.
Right. And can they understand what's going on? Do some of them, just tell me what it's like.
Yeah, absolutely. People definitely understand what's going on. They see the news like everyone else, and what we're doing is trying to reinforce good hygiene practices and prevention. It's all about prevention with our staff, with the folks that we serve.
And the folks that you serve too. Just to put a fine point on it, this is 24/7 care in these homes that Envision staffs, and so you can't just walk away from these individuals who need that care. This is they don't have anywhere else to go. One of the things that probably a lot of people don't appreciate who don't have a family member or a friend who has an adult family member with a developmental disability is, you age out of a lot of state services, and then a lot of these families and these individuals struggle to get the round-the-clock care that they need.
That's right. Most people don't understand how that part of the system works or how the system works. But up until age 22, the public school system supports, kids with developmental disabilities. But the children's system and the adult system are completely separate systems. And so at age 22, families fall off a cliff and they go onto this waiting list until such a time that services become available.
Yeah, I think people have this idea that, everybody's at Misericordia. And,
Yeah.
it just, and Misericordia is a wonderful organization, but
Right, you can't get in. I mean, you got to sign up when the kids are 3 or 4.
well, there's a capacity issue like
Right.
anything
Yeah,
else.
yeah.
There's a supply of the care and the space versus the demand, Mark.
That's right. And almost all of our people, like 95% of the people that we serve, come from homes, come from families who live in poverty. So there aren't those extra family resources to help people along. Our families aren't a fundraising group. They're there to provide emotional support when they can. And really only about a third of our families, of our individuals, have families to support them. The others don't.
Is there anything we could do to help?
Oh boy, if anybody's gotten the N95 masks handy, we really need those.
I might have a stack.
Well,
For real?
Yeah, for real.
she's a hoarder.
Oh,
No, hey, I'm a giver now.
I've already referred her to the Department of Justice.
Okay,
Yeah.
Yeah,
So
William
she-
Barr
she-
was
she's-
talking to me last
So
night.
she's got to get rid of them, Mark. Yeah.
No, I do have a stack. Not, I mean, it's
What?
6 of them, but I've got one for each person in my family, and I have 6 extras.
that'd be great. We don't need a million of them. We need a supply on hand so that if somebody does get sick, then our staff can have our individuals can have masks right away.
Okay.
So that'd be great. Any sanitizing supplies? Like everybody else, this stuff is in short supply.
No, you can't get it. You can't even get it on Amazon. They said I could get a package
Right.
July 3rd. Like, oh wow, that's great.
Well,
Not helpful.
Yeah,
So,
thanks a lot.
so 2 categories of assistance here. Mention where if people want to support Envision specifically. I think everybody's getting familiar with the equipment that people that are serving other people in a health setting need. So provide that information, Mark, and then also talk more globally, both at the state and federal level, in terms of what people should be telling their elected representatives in terms of including those who serve developmentally disabled persons in the aid packages they're putting together.
Yeah, absolutely. And so the major thing right now, finances have been on the back burner, right? The most important thing is the service that we're providing. But at the end of all of this, there has to be, we live on basically no margins with the way things are, the way the system is here in Illinois. So aid packages that come in have to include support for people with disabilities. And that is the message for the federal government as well as any state aid that comes along. And when this is all over and the legislature gets back to work, they absolutely have to put developmental disabilities system rate increase into the budget. We've gotten little tiny increases for wages over the last couple of years, and we have to really strengthen the system to not have to rely on a couple of pennies every year. So that's where we are policy-wise.
And on that state level, I mean, those the support, increased support for wages is attendant to the mandated increases in wages, right? I mean, so otherwise it's an unfunded mandate from the state or the city.
Absolutely right. Until recently, the state reimbursement did not even come up to the level of the minimum wage. So we were getting paid sub-minimum wages and paying our staff, right around minimum wage. So the legislature I know is working on this, and no, they're working on it. But it's an entire systemic change that has to happen here in Illinois.
And at the federal level, 1.8 trillion is the roundabout number in terms of what's being debated and continues to be debated. And so the argument is talk to your congressional representatives to make sure there are resources, whether it's embedded in state block grants or it's a separate line item for, again, service providers to the the developmentally disabled community.
Absolutely right.
And then going back, specific to Envision Unlimited, if people wanted to donate masks like Amy was suggesting, how do they do that?
Sending to our central office, which has a skeleton crew at this point, just to accept donations at 8 South Michigan, Suite 1700 would be the place to do that.
What's the address, Mark? You broke
8
up.
South Michigan.
8 South Michigan.
Suite 1700. Zip code is 60603 in
Okay.
Chicago.
And you can get all the information about Envision Unlimited, envisionunlimited.org, envisionunlimited.org, and that of course has all the contact.
And Mark, too,
information.
I would reach out to the
Absolutely.
governor's office too about masks, because they said
Yeah,
yesterday.
thank you. I heard
producing more.
that on the press conference yesterday.
Yeah.
So we're hopefully that's a real number. They'll be able to get that out to the biggest hospitals.
And
So yes, please.
And with respect
Go
to other agencies, because I know this is a tight knit community, other agencies that do similar work or do another aspect of serving this community, has there regular communication going on about the advocacy work as well as about the day-to-day obligations?
Absolutely. We're having twice a week Zoom meetings online to share resources, see what our respective needs are, get updates about what's happening on the policy front, that sort of thing. Plus the emails that go back and forth. There's a lot of information.
And so I assume that Misericordia, UCP, Seguin, and all of the different nonprofits that serve developmentally disabled people in Illinois are in the similar situation in terms of their needs, just like Envision.
Absolutely right. And we're all in it together. And it is, I'm happy to say professionally, it's a good, strong professional network.
He is Mark McHugh. He's the president and CEO of Envision Unlimited. Envisionunlimited.org is the website. Mark, thanks so much for joining us. Appreciate it.
Thanks, Dan. Thanks, Amy.
Thank
Take care.
you. And he joined us on our turnkey.pro answer line.
It's news, opinion, insight. This is Chicago's Morning Answer on AM 560. The Answer.
Transferring paper files to digital used to be complicated and expensive. Data and document capture had many IT layers involved. It was expensive, time-consuming, and labor-intensive. Not anymore, thanks to the Alaris Infuse Smart Connected Scanning Solution from Kodak Alaris and IDT. The Alaris Infuse solution makes data and document capture easy, and it's powered by Capsys Capture Online. Within a matter of minutes, you'll be able to accurately and reliably onboard content with instant notification of data issues, making the entire capture process smarter and more efficient. IDT can show you how to onboard content and make point-of-origin capture simple with the Alaris Infuse solution.
Relieve the burden of managing and maintaining business systems with IDT, helping your business keep pace with the evolution of information production and management. Set up a consultation today. Visit ready4idt.com. That's ready, the number 4, IDT.com. Or call 877-SCAN-IDT. IDT, putting paper in its place.
Well, you've likely heard a little about Mike Lindell, the founder of MyPillow's personal story of how he turned his life around from drug addict to successful businessman. Well, Mike Lindell has self-published a book about his story and has authorized me to offer our listeners a $25 gift card if you purchase the book. And you should get the book. I just started reading it because plenty of time on our hands these days. And what else is great about MyPillow and the $25 gift certificate you'll receive when you purchase Mike Lindell's book is that there's still great offers on MyPillows. The Giza Cotton Sheets set is